And compliance analyst Catherine Asapokhai Utsalo joins me for more insight on this. Good to have you join us, Catherine, on this hour. You live in the U.S., so let's get the latest from you on the coronavirus outbreak in the U.S.
Thank you for having me here today. When it comes to the coronavirus in the United States as at today, there's a limit to what I can say to you because the CDC is in the best position to give you the actual latest. I'm just going to talk to you basically how it affected our event when it comes to the United Nations event, CSW, the Council of the Status of Women. Yeah, due to the coronavirus, everything was scaled down. It's supposed to be an event starting from the 9th to the 20th of March. It was scaled down to just one day, which was the 9th of March. And that led to a lot of cancellation of hotels booking, travels, and all that. This has affected a lot of us in the sense that investment has been put into that event. And because of the cancellation, unfortunately, a lot of the hotels have been very cooperative, and a lot of the airlines also have been able to cancel flights without any fees and cancel hotel reservation without any fees. So when it comes to the spread, yes, it is spreading, but it is also curtailed. The United States government is doing the best that it can to make sure that it does not spread beyond what is going on right now. I can speak generally when it comes to North Carolina. Yes, we have, according to the news, that we have 1 or 2 cases, but it has not spread beyond that. So I'm going to say when it comes to coronavirus, the precaution that we all have to take is make sure we wash our hands, make sure we use things like Lysol. And when it comes to a lot of people coming from Africa, I tell them, use things like Dettol. It also works. It's as good as Lysol. So it doesn't have to be Lysol alone. So take precautions. Make sure when you go to restaurants before you eat, you make sure you wipe your hands properly when you come into your house, your doorknobs, your car, your kids going to school and coming back, the school bag, as much as we can, have all the spray that you can have, and spray your children's school bags when they come back home. Spray your car seats before you sit down, and do all the things necessary that you can to do to prevent it.
All right, Catherine, let's stay with the Women's Conference. You said the hotels and the airlines have been very generous in terms of canceling these flights and returning fees. But there was also an agenda for this meeting. So how are you finding your way around that?
Well, right now what we are doing is we are waiting for the United Nations to tell us when next we're having this event. Because right now, though cancelled, there is a plan on ground to have it in the near future. So nothing has changed when it comes to what we want to present and the people we want to work with. Our hope is that most of those coming from outside the United States, that as at the time that the new date is fixed, that the visas are still valid and their passports are still valid, because having to do the CSW 64 without the international community coming together in the United States, that is going to be very, very low key, and that is going to mean we're having less than 80% participants. So we are hoping, and we're telling everyone, if your visa is about to expire, please go and renew your visa, because yes, CSW is still going to hold. Thank you.
All right. I mean, this is just one of many events that have been cancelled around the world. Whether entertainment, whether sports, religious events, every sector has been affected because of the coronavirus. What impact do you think this will have on the travel and tourism sector?
It definitely has a great impact, because when we're talking about CSW, we're talking about over 2,000 women and men coming into the United States from all over the world. And when they come, they don't stay only in New York. After the event, most times they go about visiting other states. So we can see a serious crunch when it comes to hospitality management or hospitality industry. Yes, it is affecting them. But we are believing that the decision that the government has taken for now, scaling down event, is the best decision because it is better to be safe than sorry.
We're also seeing the World Health Organization saying there's going to be shortage in medical supplies, and there were seeing people who are also doing panic buying. What should we be doing right now in terms of ensuring that we do not have shortages, especially in food supplies?
Well, in all honesty, there will be shortage in food supply. In situations like this, there will be. Because when you talk about the local farms, when you go to when you're in a city where there is coronavirus, then there is shortage because there are some farms that ordinarily people will not want to get foods from, especially if the farms are in the location where you have the victims. So yes, is there shortage? Yeah, I was at the mall some days ago. I can see even shortage when it comes to a lot of things. I was at the grocery store and I'm looking at some aisles, and a lot of the things that ordinarily we will get to buy, some of the fresh vegetables, some were not there. Is it that bad? It has not gotten to a stage of any panic. But yes, we will ask everyone, whatever you can store for now, yes, store them, freeze your food, put them in the
All right.
freezer, get frozen one.
I'm afraid
Yes.
we do have to go. Compliance analyst Catherine Asapokhai Utsalo, many thanks for your time on this issue.